Hi, I'm Monique Williams and I'm from Section 6, and now I'm going to demonstrate how to hang a piggyback IV when a primary line is already infusing. I've already done my hand hygiene. I have checked the MD orders, and the MD has ordered for this patient to receive vancomycin. Vancomycin is an antibiotic. The doctor has ordered for the patient to receive 500 milligrams infused over 1 hour's time frame. And with vancomycin, the patient has a risk for ototoxicity and nephrotoxicity. So I would need to order a baseline hearing test as well as look at the patient's renal functions or kidney functions. So the first thing that I want to do is I want to draw up my medication. So the patient has been ordered to have 500 milligrams per milliliter. So I will draw up 1 milliliter of my vancomycin. This is my vancomycin. And I've looked at the bottle to make sure that it has not expired. It has not expired. So I'm going to clean off the top. And again, I did my calculation and I know that I need to draw up 1 milliliter of vancomycin. And then I already have my bag of saline solution, so I'm going to clean off the top of the bag, and then I'm going to insert my medication, go directly in and not puncture any of the sides of the bag, and infuse my 1 milliliter of vancomycin. And using the one hand scoop method, just put this to the side. It's going to go into the sharps bin. I'm going to agitate and rotate my bag so that it's mixed very well. And then once I'm done with that, I'm going to label my medication bag. On the medication label, I will put the name of the medication, vancomycin. It's 500 milligrams. I'm going to put the patient's name, and then I'm going to date it, time it, and also put my initials on it. I'm also going to label the tubing that I'm going to use for this particular patient as well. And I'm going to label that with the date, the time, and my initials. So I'm also going to calculate my drip factor, or not my drip factor, but my drops per minute, so the rate that I'm going to actually infuse this medication. So it's going to be 100 milliliter of solution over 60 minutes. The medication is already in the solutions. The drip factor is 10 drops per minute. So when I calculate that, I come up with 17 drops per minute. So I'm going to go in, I'm going to introduce myself to the patient, I'm going to check the IV site that's already been in place to make sure that there's no signs of redness, phlebitis, pain, erythema, anything that would contraindicate this patient taking the medication, as well as making sure that the patient can tolerate the medication and has no allergies. Okay, so here we go. Knock, knock, knock. Hi, I'm Monique Williams, and I'm a nursing student. How are you today? You're doing good? Very good. I wanted to start by asking you your name and your date of birth, just for verification. Okay, Kelly Jackson, 3/23/23. Okay, very nice to meet you. I see that you already have an IV line running already. Your doctor has ordered for you to have vancomycin. Can you tell me whether or not you've ever had vancomycin before? No? Okay. Well, do you have any allergies to penicillin or cephalosporin? No? Okay, very good, because it's contraindicated if you did, and I noticed in your chart you don't, and I just want to double check to make sure you don't have any allergies. Can I just take a look at your site? Okay, everything looks good. I don't see any redness, no erythema, no phlebitis, no infections. Okay, everything looks really good. So the first thing I would do is don my gloves. would take out of my packaging my piggyback tubing. It's already been labeled. And then take my medication bag and open it up. And then I would insert my line. And then I would squeeze this until it's a third to a halfway full to get that ready. I already have a primary line running. So what I would do is I would lower my primary line. And I would hang my piggyback tubing above, or piggyback IV above the primary line. Okay. I would then clamp off the primary line because now I'm going to infuse the piggyback line first. So I would stop that one. Okay. And I have my drip chamber already going. I want to prime that. Make sure that it's ready, and it's ready. It's good. Let's clamp that off. Then I would find the port that is below, and I need an alligator clamp for this. So I have my alligator clamp. I would clean off my site, connect the alligator clamp to my line, and then also connect this part to the port. All ready to go. And then I would turn on my infusion, and I would time it. My drip factor, or that I've already kind of, or not my drip factor, but my drops per minute is 17 drops per minute. So for a minute, I would watch to make sure that it's only 17 drops per minute. If it was too fast, I would slow the infusion rate down, and if it's too slow, I would speed it up. So I would open this up and watch it for a minute. Once that's done infusing, I would disconnect this alligator clamp, and then I would reconnect my primary line and let it begin infusing again. So after all of that is done, I would check the site again, make sure that there's no redness or erythema or any phlebitis. Ask the patient if they have any discomfort. I would, if they do, I would have them call me if they need any issues. So I would put or if they have any issues, I would put the call button within reach. And then in their chart, I would document that the patient tolerated the procedure well. I got it in on one try. I would also document the site and the location, so use the right arm. And then the type of medication, the dose, the infusion rate, my initials. I would also monitor any intake or output and how well the patient tolerated the procedure, and any other completion protocols, you know, as far as just letting the patient's bed back, making sure that the tray table is within reach if they have any personal belongings. And that should conclude how to do a piggyback, my demonstration on how to do a piggyback IV insertion. Thank you.